Dr. B, how would you advise someone to pay for nose surgery?
Of course, there are certain options, and as we discussed, there's trying to get your insurance involved with it. It's the most important with nose surgery, as well as checking with different finance companies. Some people have a credit union, some people have the money saved, and so of course there's credit cards and those kinds of things.
And what are the different types of anesthesia involved in nose surgery?
Well, even though some surgeries can be done under local anesthesia, most nose surgery is done with at least intravenous sedation, meaning twilight sleep. Often, if I'm doing that in my office, we would accompany that with some oral sedation, meaning pills before the procedure, so that you're relaxed even before you go into the operating room. And then in some cases we do general anesthesia. In my office, typically we save general anesthesia for people having sinus procedures done as well. I tend to like twilight sleep because these days those drugs have become very good and very effective, and patients are generally will not remember anything. As far as they're concerned, it's the same as general anesthesia or they're asleep. On the other hand, with general anesthesia, they're breathing in some gases, they have a tube down in their voice box, and there may be more recovery related to those kinds of features.
And what should an individual think about before having their surgery?
Well, I think there's in your mind there should be sort of a checklist of things you want to get taken care of before you actually have your surgery. You want to make sure that you've arranged for your payments. You also want to make sure that you've arranged for your transportation before surgery so that you're there on time, you've accounted for traffic, you know where you're going, and then of course someone to pick you up appropriately after surgery. If you have medications that you need, you want to have them called into the pharmacy or pick them up before surgery whenever possible. Any medications that you're on or that you're taking, you want to find out what your doctor wants you to do about them on the day of surgery. So you want to make sure that you, if he wants them to take them with a little sip of water before surgery, you can do that. Or if you're supposed to discontinue them, you need to know about that. No aspirin before surgery, at least 10 days before. Any kind of blood thinner could create a horrific problem with nose surgery in particular, since there does tend to be some bleeding after surgery. Aspirin is the worst one, but also vitamin E may cause some bleeding after surgery. There are other blood thinners, of course, that people with heart problems may be on, and even some herbals may cause blood thinning, and so you may need to be off of them for some certain period of time before your surgery. Also, if there's anything particularly the doctor wants you to get related to your surgery, any kind of splints or supports or anything like that, you want to make sure you've arranged for them before your surgery. Before nose surgery, I'm often requiring patients to have decongestants, for instance, that they use to help them prepare. Also, whenever possible, you want to review your consents and review all of your history forms and get them straightened out so on the day of surgery you're ready to go.
Is it common for an individual to need more than one nose surgery?
And some doctors consider that nose surgery has the highest revision rate and will quote patients even 10 and 20% of the time needing revision or requesting revision. And it's also a relative concern. So a tip that's too crooked for one person might be perfectly satisfactory in another person's eyes. And so there's always something to correct or change or consider improve with the nose because perfection is so rare. But sometimes, just depending, more to do with the person's aesthetic goals than there is a genuine hard necessity to redo something. But every now and then after surgery there is a genuine dent or bump or something that needs to be touched up and we just need to do a little more.
And do you think that most plastic surgery patients are happy about their nose procedure?
I think the vast majority are extremely happy. I think they have gotten a nice improvement. Again, as long as they're accepting the limitations of surgery, but they almost invariably get a great improvement. The question is, are they satisfiable with that improvement? And most people are. I think they understand and they have a very positive experience.
So what should people think about having nose surgery?
Well, I think it's something that people plan on. A lot of people are very self-conscious about their nose, and I think that they can, it can be a very positive experience for people. We do a lot of nose surgery, and it's very popular, and I think it can really help people with their self-esteem.
Thank you, Dr. B. We enjoyed that discussion.
Thank you.